Today we are going to discuss your diabetes insipidus, another concept in your medical and surgical nursing. Don't worry, because on this video I am going to break it down to you to the T. Nursing care management of your diabetes insipidus and more in one video. If you want to know more about that, stay tuned. Welcome back to my channel. If you're new here, my name is Neil Gavin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos once a week. Don't miss it out. Subscribe now. Hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, let's jump into the video, nurses. Hi everybody, how are you guys doing? Now, just in case I don't get to see you, let me greet you good morning, good afternoon, and good night. Yes, isang panibagong medical surgical discussion nga ang alay ko sa inyo for today because just like what you see on the title, today is another entry natin sa ating medical surgical nursing. Today, we are going to have a thorough discussion of your diabetes insipidus. Yes, DI. Everything that you need to know down from the cause, the clinical manifestations, diagnostic procedures, medical management, and of course, your nursing management. All of that and more in one video. Now, kung hindi mo pa napapanood yung other discussion na ginawa ko under sa concept ng medical surgical nursing, ililink ko yung link sa description box or kapag nag-pop out itong icon button, i-click mo lang yon kasi nandyan sila lahat kasama ng ibang mga playlist. Ngayon, you guys, we've been really growing and I wanna take this opportunity to thank everyone, especially you who's watching right now. Maraming salamat po sa pagsuporta at paniniwala sa channel. Kaya naman, medyo mahaba itong discussion to. Hindi ko na masyadong patatagalin pa. In order for me to do that, I will need to switch back to my PC and I'll see you guys in a bit. So hi everybody, welcome back sa ating formal discussion ng yung diabetes insipidus, nursing care management. This is another concept natin sa ating medical surgical nursing kung saan we are going to tackle diseases na related sa ating medical surgical nursing. Ngayon, this is not the actually the first discussion that we did under this playlist because I created tons of discussions related to medical surgical nursing. So I'll be putting the actual playlist on the description box or simply click the icon button once na nag-pop out yon. Now, let this be your nursing study guide sa pag-aaral mo ng diabetes insipidus. So let me share to you our objectives for our today's discussion. This video, we're going to discuss or to answer the question, what is diabetes insipidus? We're going to have the causes, the types of diabetes insipidus, clinical manifestation, diagnostic findings, medical management, and of course, your nursing management. Handa ka na ba? Hinga-hinga, let's begin. First up, what is diabetes insipidus? Alright? So, sasagutin na natin to ha. So, ano nga ba ang ating diabetes insipidus? Okay, so it is an uncommon disorder that causes an imbalance of fluids in the body. Imbalance nga po ng fluids sa ating katawan, okay? Next, this imbalance leads for your body to produce large amount of urine. So, yun yung kanyang clinical manifestation, large amount of urine. Alright, now while terms diabetes insipidus and diabetes mellitus sounds familiar, they're not related. So marami pa rin na nalilito sa atin pag sinabi natin diabetes insipidus at diabetes mellitus, D-I and D-M. Pag sinabi mo kasing diabetes insipidus, you're talking about polydipsia and polyuria. Large amount, not just polyuria, but large amount of urine. Pag sinabi mong diabetes insipidus and diabetes mellitus, ano yung tinatalk about mo doon? O ano yung pinapertain mo doon? Sugar problem. Endocrine, pareho silang endocrine disorder, you guys. But when you talk about diabetes mellitus, you have two classifications, DM1 and DM2. Alright? So you're talking about problems with sugar. Ito napapasok si insulin. Ito napapasok si blood sugar level. Ionation siya. But diabetes insipidus and diabetes mellitus are not related at all. Alright? Okay. So, definition of terms po tayo ha. Diabetes insipidus is caused by problems with a chemical called vasopressin. Narinig mo na ba to yung AVP? Which is also known as anti-diuretic hormone. So sa video discussion natin ngayon, ang gagamitin nating term is ADH. Most of the time, ADH tayo. Pero sa ibang libro, tinatawag nilang ADH is AVP. But I want you to understand that when you say AVP or vasopressin and ADH or anti-diuretic hormone, iisa lang po sila. They are the same. Okay? Those terms are kind of like used interchangeably and that's okay. Alright? Now, ADH is produced by the hypothalamus and stored in the pituitary gland until needed. You guys, when you talk about diabetes insipidus, I want you to remember three particular parts of the body that is being affected. Ano yung una? Guguhitan ko ha. You have your hypothalamus. Ano daw yung hypothalamus natin? This is where our ADH, anti-diuretic hormone, is produced. Saan ini-store matapos ang secretion ng hypothalamus ng iyong ADH? Saan niya nilalagay yon? Sa pituitary gland. Saan ang pituitary gland mo? Nandito siya. Nasa likod lang siya ng iyong. So the pituitary gland is located behind the bridge of your nose. Ayan po siya. Napakaliit lang po niya. Meron niyang anterior and posterior pituitary gland, ADH, okay? Para mas madali sa'yo, anti. Bakit ko mas pinili nga pala yung term na anti-diuretic hormone versus sa vasopressin? Kasi it will make more sense sa mga discussion natin sa mga susunod, ha? Anti. Pag sinabi mong anti, against, inhibitor. Hindi pwede, anti. Diuresis or diuretic meaning pag-ihi. Pag pinagsama mo yung anti plus diuretic, ano ibig sabihin? Hindi pag-ihi. Prohibits diuresis motion. Or ito ay isang hormone na pumipigil sa pag-ihi. Anti-diuretic hormones or hormone, okay? So, ano pa yung isang body organ na gusto kong tandaan mo? Ito yung kidney. Now, ADH regulates the level of water in the body by controlling the amount of urine your kidneys produce. So, ano yung target organ ng yung ADH? Ang target organ ng yung ADH, once na ma-release siya sa bloodstream, ay ang iyong kidney. Anong ginagawa niya sa kidney mo? It regulates or controls the amount of urine kidneys produce. Okay? So again, mag-recap tayo. Hangit lang, adjust ko lang yung aking upuan, ha? Mag-recap tayo. Ano ulit yung tatlong body organs na gusto kong matandaan mo? Hypothalamus, kung saan yun yung nagre-release. Pituitary gland, pangalawa, kung saan it serves as the reservoir of the ADH. Ano naman yung kidney? This is your target organ where ADH actually regulates the level of water in the body by controlling your kidneys to produce urine. Alright? Next, when the level of water in your body decreases, your pituitary gland releases ADH to conserve water and stop the production of urine. Okay, compensatory mechanism ng katawan. So sabi, when our body's level of water is decreased or depleted, our pituitary gland releases ADH to conserve water. Bakit nagre-release ng ADH ang ating pituitary gland? Kaya sinabi ko, compensatory mechanism ng katawan to conserve water. Alam natin na ang ating katawan is basically made of 70 to 80% of water, if I'm not mistaken. Some books actually says that, okay? Now, para ma-retain yung yung homeostasis. But that's just, when you talk about compensatory mechanism, that's just for a short period of time. Hindi pa pwedeng laging ganon. Kaya, kailangan ng mga pasyenteng may mga pasyenteng may diabetes insipidus, immediate treatment at prompt and correct treatment ang kailangan, alright, to prevent dehydration. Ano pa? In diabetes insipidus, ADH fails to properly regulate your body's level of water and allows too much urine to be produced and passed from your or the patient's body. Alright? So, malinaw yon. Let's proceed. So, na-discuss na natin, nagkaroon na tayo ng overview about sa DI or diabetes insipidus. Huwag malilito ha, tatawagin ko siyang DI or diabetes insipidus. Alright? So, what are the causes of your DI? Well, I list down some of the common causes of your DI. Una, malfunctioning of hypothalamus. Diba sinabi ko sa tatlong body organs or tatlong body parts ang affected nun? Ano yun? Hypothalamus. Sa tingin mo, kapag may problema sa hypothalamus mo, may posibilidad ba na mag-develop ang pasyente mo ng DI? Yes. Kasi nga, ang organ na nagre-release ng ADH ay hypothalamus. So, malfunctioning of hypothalamus. Next, damage of hypothalamus or pituitary gland during surgery. Alright, so kapag during surgery, nagkaroon ng damage sa iyong hypothalamus and pituitary gland, that could also be the cause of your DI. What's next? Brain injury. Anything that has something to do with the brain where your hypothalamus and pituitary gland is located could actually result in having DI. Next, tumor. Bakit? Tumor kasi, what's this? Occupies a space. Occupies the space in the brain. At pwedeng magkaroon ng compression sa iyong hypothalamus o magkaroon ng compression sa iyong, sa pituitary gland. And that could lead to, having or being diagnosed with DI. That could lead to that could be one of the causes of your DI. So, tumor. Alright. Hindi 3 more ha, 2 more. Next, blockage in the arteries leading to the brain. Kapag poor ang blood circulation, nagkaroon ng blockage or poor perfusion sa brain, sa tingin mo ba, that could lead to some kaluan ng poor tissue perfusion sa ating brain. Sa tingin mo ba, that could also lead to your DI. Encephalitis, infection of the brain. Meningitis, infection of the meninges. Sarcoidosis. Alam nyo ba kung ano yung sarcoidosis? Now, this is actually a rare inflammation of the lymph nodes and other tissues throughout the body. Lymph nodes po, parang lymphatic system. Mostly kasi ang DI o ang diabetes insipidus kasi, this is very idiopathic in nature. Meaning, unknown etiology, unknown cause. Hindi mawari kung saan siya. Merong statistics na nagsasabi na napaka-rare nitong disease na to. And I'm actually fortunate that I was able to witness or to have a patient. Well, he's not really my patient, but we have a case in our unit, and I'm just so happy that I'm able to actually review the patient's file and take a look on, what are the clinical manifestations, the presenting signs and symptoms, the diagnostic test that is being done to him. That is why I can relate to this discussion so much, and I decided to create one just for me to share my knowledge and my experience to you guys. All right. So once again, these are the causes. Proceed na tayo. What are the types of diabetes insipidus? Okay, pag sinabi mong DI, may mga types yan ha. Parang DM din. So hindi mo lang pwedeng sabihin na DI. O anong type ng DI yon? Ngayon, sa mga susunod na slides, tatalakayin natin yon. Alright, so, there are 2 main types of diabetes insipidus. One is your cranial diabetes insipidus. Now, this is where the body does not produce enough ADH. So, excessive amounts of water are lost in large amounts of urine. Ano yung cranial? There is not enough ADH. Okay? Meaning, yung hypothalamus mo nagkakaroon ng problema, hindi nagpo-produce ng ADH. Alright? Or it could be, hindi nare-release ng maayos sa bloodstream ang iyong ADH due to malfunctioning of your hypothalamus and pituitary gland. Ano pa? Nephrogenic diabetes insipidus. Ano naman ito? When you say nephrogenic diabetes insipidus, this is where ADH is produced. Meaning, we have ADH, anti-diuretic hormone, in the body in the right levels. But for a variety of reasons, unknown reasons, the kidneys do not respond to it in the normal way. Anong ibig sabihin nito? Ang hypothalamus mo at ang pituitary gland mo walang problema. Hypothalamus produces enough ADH. and then it's being stored in the pituitary gland. But for some reason, when the body signals that when the brain receives the signals that the body is not dehydrated, or there's enough or there's less fluids in the body, when the ADH is being released in the bloodstream and its target organ is your kidneys, the kidneys is not responding to it. So ano yung pinagkaiba? Sa cranial diabetes, wala talagang ADH. Not enough ADH. May scarcity ng supply ng ADH or ng production ng ADH. Sa nephrogenic diabetes, there is the hormone, what we called ADH, but for some reason, yung target organ mo, which is the kidney, is not responding to the hormone. Hence, nagre-result sila, pareho silang nagre-result sa diabetes insipidus. Alright? Now, there's actually other types of your DI. You have your congenital nephrogenic diabetes insipidus, your acquired nephrogenic diabetes insipidus, and some other more. But on this particular discussion, we're going to discuss the two types only. Now, once again, the causes of DI is considered to be idiopathic, unknown etiology, unknown origin, very rare condition. Alright? Alright, so what are the clinical manifestations of your diabetes insipidus? Iisa-isahin natin to. Now, the two main symptoms, nurses, of diabetes insipidus are often needing to pee a large amount of urine and feeling extremely thirsty. Now, we're also going to touch on some of the other clinical manifestations of your DI. Alright, so handa-handa na kayo, ha? First up to 20 liters of urine per day. 20 liters. Do you imagine how many that is? Now, ano bang norma? Para ma-appreciate natin itong 20 liter na to. Ano bang normal value ng urine natin? Urine output. Diba 30 ml per hour? I-times mo yon sa 24 hours kasi we have 24 hours per day. So that's 720 cc or ml per day. So, kung i-convert mo yung 20 liters into ml or cc, that is 20,000 ml per day. Oh gosh. That could really result in extreme dehydration. You know what I mean? Hypovolemia and all. So, again, ang normal urine, para ma-appreciate mo tong 20 liters na to, tandaan mo lang yung normal values ng urine output mo. 30 ml per hour, which is in a 24 hours urine output collection, you have 720 cc per day. Alright, that is your normal value. Imagine how many had the volume of that urine output per day. Next, you have your decreased specific gravity. Okay, so para ma-appreciate mo, paano mo ba malalaman, ma-differentiate? Ay, decrease ba or increase? Ang normal value po ng iyong specific urine gravity is what? 1.005 to 1.030. Again, your normal range of specific gravity is 1.005 to 1.030. Alright? So, pag sinabi mong decrease, is it more than 1.005 or is it less than 1.005? The answer is B, 1.005, less than 1.005. Alright? So, huwag kayong mag-alala kasi parang nag-create po ako ng mga normal laboratory values. I actually touched down these parameters doon sa discussion na yun. Ililink ko rin siya dyan. Okay? O nga na, hindi ko na nasundan yung video na yun. Pero huwag kayong mag-alala. Susundan natin, gagawan ako ng mga videos regarding doon. Next, decrease osmolality. Now, ano bang normal value ng iyong osmolality? So, normal result is typically what? 500 to 850 milliosmoles per kilogram of water. Alright, so again, that's 500 to 850 milliosmoles per kilogram of water. So, decrease osmolality, meaning less than 500 po ang titingnan mo na value. So, kapag mas mababa sa 500 milliosmoles per kilogram, your patient could, isa yun sa mga identifying factors ng patient mo, could be having what? DI. Ano pa? Hypovolemia. Anong normal values mo? In adults, the average adult weighing 150 to 180 pounds should have about 1.2 to 1.5 gallons of blood in their body. This is about what? 4,500 to 5,700 ml of blood in the body. So pag sinabi mo hypovolemia, is it less than or more than 4,500? Of course, it is less than 4,500 because that is your normal value. That's the essence why we need to find out what is our normal value for us to differentiate and to really determine if this patient is really having what? DI. Alright, what's next? Polydipsia, or pinasosya lang to, ito ay actually thirst, excessive thirst. Next, you have your tachycardia. Now, paano mo naman masasabing ang pasyente mo ay tachycardic? So, dapat alam mo rin yung normal values. Ano ang normal values ng iyong heart rate? That is 600 to 100 beats per minute. So, tachycardic ang pasyente mo kapag more than 100 beats per minute, right? Alright. Now, decreased blood pressure. So, ano naman ang normal value ng iyong blood pressure? Now, a normal blood pressure level is less than 120 to 80 millimeters of mercury. So, may mga ibang libro sa kagaya ng American Heart Association na sinasabi nila stable ang blood pressure ng pasyente mo kapag 90/60. So, doon tayo sa doon tayo sa gitna. So, 90 or kunin natin yung range ha, kasi sa Cochere, sa Saunders, ideal kasi yung 120/80. But it depends, it varies per each individual. Okay? So, sabihin na natin 90/60 to 120/80. That is your normal blood pressure. Ganun ang tinitingnan ko sa sarili ko eh. Kasi according sa American Heart Association, 90/60, that is stable blood pressure. Right? Okay. Now, diagnostic findings. Paano mo nga ba ita-diagnose ang iyong DI? So, I list down 3 diagnostic tests that could confirm your what? Diabetes insipidus. Ba't ba ako hinihingal? First up, you have your water deprivation test or fluid deprivation test. Ano ito? Now, this is a medical test which can be used to determine whether the patient has diabetes insipidus as opposed to other causes of polydipsia. Excessive thirst. The patient is required for a prolonged period to forgo intake of water completely to determine cause of the thirst. Water deprivation, meaning dine-deprive siya for a test for a period of time to determine the cause of the polydipsia. Alright? What's next? Anti-diuretic hormone test or ADH test. Alright, so this is blood extraction po. Now, ADH test measures how much ADH is in your or in the patient's blood. This test is often combined with other tests to find out what is causing too much or too little of this hormone to be present in the blood. Alright? Next, MRI scanning. Bakit kayo gumagawa ng MRI sa pasyenteng may DI? Malalaman natin yan kasi nga, naalala mo yung mga causes natin, may tumor, may malfunction sa hypothalamus. Diba? So makikita yon through MRI. Now, patient may need an MRI scan if the endocrinologist thinks that the patient have a cranial diabetes insipidus as a result of a damage to hypothalamus or pituitary gland. Malinaw yon? Malinaw. Once again, these are the 3 diagnostic tests that could probably confirm your DI. Proceed na tayo, malapit na tayo matapos. What are the medical management of your diabetes insipidus? Ito, I list down a couple of medical management, but I kind of like categorize them into 2. You have your general. Now, generally, identification and treatment of underlying cause is one of the medical treatment. Next, venous thromboembolism or VTE prophylaxis if the patient is hospitalized. These are the general medical management. Kailangan mo rin bang pakialaman yung diet ng pasyente mong may DI? Of course. Now, you need to control or to instruct your patient to control fluid balance. Health teachings po ito. Diba? Kasi nga, kailangang imbalance na nga yung kanyang fluid, so you need to make sure that you provide that health teachings to your patient. Next, dehydration prevention. Alright? So, signs and symptoms ang educate mga pasyente mo regarding the signs and symptoms of dehydration. What else? What to do when it comes to compliance to treatment, and what are the what's this? How to prevent being dehydrated. Next, low sodium, low protein diet. Bakit low sodium, you guys? Low sodium kasi wherever sodium goes, water will follow. Naalala mo yung rule na yun? So kapag nilagay mo ng lalo ng sodium dyan sa katawan ng pasyente mo, kapag high sodium ang diet niyan, it will attract more water, hence patient ay iihi ng iihi. Next, medications. Ano-ano kaya yung mga gamot na pwede nating ibigay o administer o i-prescribe ng physician natin sa ating pasyente? Una, intranasal or nasal desmopressin, acetate, or subcutaneous vasopressin. Ano pa? Hydrochlorothiazide orally. Possible hydrochloride orally added to hydrochlorothiazide for enhancement of agent for central DI. Chloropropamide or hydrochlorothiazide as a second-line agent for central DI. Non-steroidal anti-inflammatory agents such as indomethacin to enhance urinary concentrating ability. Ano pa? Carbamazepine to help release ADH, not useful with nephrogenic DI. Okay, mind you, this is not useful for nephrogenic DI. Ano yung nephrogenic DI? There's enough ADH pero hindi siya nakikilala ng kidney mo, which is the target organ of your ADH. Alright, so hindi niya nagagawa yung function talaga ng hormone, which is to regulate fluids or urine in the body. Alright, now IV fluids such as dextrose, 5% in water, or hypoosmolar IV fluids based on the patient's serum osmolarity. Alright, now surgery po. Pwede ba tayong gumawa ng surgery? Yes. Well, this is actually not indicated unless required to treat an underlying cause such as tumor, which is one of the causes of your DI. Malinaw yon? Okay, so ito na pinakahihintay nyo, nursing management. Okay, paano nga ba natin ito i-manage? Medyo mahaba ito ha. By the way, ang aking reference dito ay Lippincott and Saunders. I also tried to look up in Google, but I tried to put them all together in one slide para naman meron kang malinaw at solidong reference. Okay? Next. So, ano nga ba ang intervention mo? First, administer medications as ordered such as intranasal desmopressin acetate. If IV fluids are ordered, initiate IV access and maintain patency. Administer IV fluid replacement as ordered, usually 500 to 750 ml per hour to prevent fluid overload and hyperglycemia. Assess hemodynamic status as indicated. Auscultate heart and lung sounds for changes. Ano yung auscultate mo? Signs of congestion, right? Provide meticulous skin and mouth care. Alright? Bakit? Dehydrated ang pasyente. Tingin mo yung oral mucosa niya in good condition? No, it's dry, which is prone for breakage, and when there's breakage, there could be a portal of infection or pathogenic microorganism that could lead to other infections. Alright? Next, ensure readily available access to a bathroom, bedpan, or commode. Bakit ito mahalaga? Bakla ihi ng ihi ito, girl. Kung hindi mo siya bibigyan ng bathroom, ng bedpan, or commode, yung access, easy access sa bathroom mo, parusa yun, wag mo siyang torturing, okay? Next, encourage adequate fluid intake. Ensure that the patient has free access to water because one of the clinical manifestation or yung kanyang hallmark sign ng iyong DI is excessive thirst, polydipsia, and large volume of urine. Not just polyuria. Polyuria kasi is frequent urination, right? But polyuria with excessive large amount of urine, 20 liters per day. Obtain daily weight. This is very important. Check skin turgor for evidence of overall hydration status. Alright? Next, ano pang pwede mong gawin as a nurse? Well, you can assess for signs and symptoms of fluid overload if the patient is receiving IV fluid therapy. Apply anti-embolism stockings or sequential compression stockings to prevent what? VTE, venous thromboembolism. Okay? Next, encourage the patient to verbalize feelings while providing a realistic assessment of the situation. Provide support and encouragement as needed. Ito na papasok ang iyong holistic care.
Hindi lang yung mismong treatment o yung sakit ang gagamutin mo, pati rin yung kanyang spiritual, emotional, chorba. Gagets nyo yun? Gagets na. Next, help the patient develop effective coping strategies, model of positive coping strategies. Obtain laboratory specimens for testing such as urine and serum to determine osmolality and electrolyte levels as ordered. Evaluate urine for specific gravity. Tiniskas natin kanina yung mga normal values ng iyong urine specific gravity and osmolality and all. Balikan mo lang yon o panoorin mo yung slides ko o yung video discussion ko about sa laboratory values. I have part 1 and part 2. Okay? Prepare the patient and family for possible surgery if the underlying cause is tumor or mass. Kasi diba, indicative ang surgery sa mga pasyenteng may DI kapag ang cause is tumor or brain mass. Okay? Alright. So, monitoring na. Siyempre, importante ang monitoring. Kasi may daily weight ito. Okay, ano pa yung mga titingnan mo aside sa weight? Well, intake and output, 24-hour urine output volume collection. Urine collection po ito. I know. Vital signs. Daily weight, urine-specific gravity, and osmolality, very important. Serum electrolyte level, specifically sodium level. Why sodium? Because wherever sodium goes, water will follow. Kailangan mo yung i-check. Baka naman na sobra sa asin ang katawan ng pasyente mo. Baka naman sa diet niya, hindi natingnan. Imbes na gumaling ang DI niya o imbes na ma-resolve ang kanyang DI, hindi. Kasi ang taas-taas sa asin. Next, blood urea nitrogen level. Signs and symptoms of hypovolemic shock. I actually created a discussion of your clinical manifestations in a thorough discussion about yung hypovolemic shock. Ililink ko siya dyan, ha? Panoorin mo yun kasi hypovolemic shock is a different discussion. I also created neurogenic shock and marami pang klase ng shock. So, panoorin mo yan. Changes in mental and neurologic status. Okay? Ano pa? Change in LOC yun. Level of consciousness. Next, cardiac rate and rhythm. Bakit? Kasi nga, tachycardic and decreased blood pressure. Right? Ano pa? Thirst. Very important. Hallmark sign niya. O diba tapos na tayo? Thank you so much, nurses, sa inyong pakikinig. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. Comment it down below. Abangan niyo po yung mga next video natin sa mga susunod na linggo, ha? Iti-discuss naman natin yung iba pang kung meron kayong mga topic suggestions na pwede nyong ma-suggest sa akin sa susunod nating video discussion, sabihin nyo lang, ilagay nyo siya sa baba. Maraming salamat po sa pagsuporta and I really appreciate you guys. We've been really growing and none of this will happen if it wasn't because of you guys. Malapit na tayo sa 10K guys. Kaya naman ilaban na natin to. Ipamalitan nyo na. Help me out, spread the news about my channel. Ipamalitan nyo na sa Radyong Sira ang pinakabago, pinaka-fresh at ang pinakalibreng nursing review center sa balat ng YouTube. And I'll see you again next time.
Thank you so much you guys for watching. I hope you learned something. Help me grow my channel. You are already here. You might as well subscribe. Hashtag Team Kulto. Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out the other playlists I created for you. I'll be putting the links on the description box. You simply click this icon button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Galvin. I'll see you again.